Welcome back, and thank you for staying with NTV Weekend Edition. You're still with me, Sandra Twinobio. Now, today is day one of the 42 days lockdown imposed by President Yoweri Kaguta Museveni, something that is having majority of the Ugandans, worry about what happens tomorrow, what happens next, how do we survive for the next 41 days. We have seen the surge in COVID-19 cases. The country's health facilities are in crisis with a shortage of oxygen supply for patients who need these services. There is also the problem of a shortage of health workers to deal with these patients. Some of the health workers are also contracting COVID-19 and of course are taking some time off. This is worrying the majority of Ugandans as well. We cannot also forget the increasing prices of healthcare going through the roof, which is government. And now the bigger question is, what is government doing about it? We would like to understand what is the strategy that the government should use to address all these issues that Ugandans are bringing to the front. Now, to shed some light tonight, we pick the thoughts of ALLANA Kembabazi, who's the programs manager, Right to Health at the Initiative of Social and Economic Rights. A very good evening, ALLANA. Thank you so much for joining us again. This is starting to feel like home for you. How are you doing?
I'm good, and it's so good to be back. Unfortunately, at a very sad time.
Yes, exactly. Now, when you look at the numbers, at least if we were to look at the Ministry of Health statistics from the 16th, we did see 42 people dying, to COVID-19. We did see an increase in the infections, standing at 1,564. And the total number of cases right now of the people that have succumbed to COVID-19, we can say 584, at least according to the Ministry of Health. As we speak and as we get into the lockdown, do you think the healthcare system can handle the rising number of COVID-19 cases at the moment?
Yeah, I don't. And we've spent the last week on a campaign drawing attention to this. We started off by asking government to do 10 things. And then another one specifically on oxygen. And then we later on saw that what happened at Mulago. And the stories are very jarring. The number of ICU beds that have run out, but also the very, very high cost of healthcare. Because you have in the government facilities, there is no space. You find oxygen malfunction issues, and then there's just the private are on a whole new level. They've really profiteered, I think, of the pandemic. The stories we have been getting from the community have been very jarring around what the price of basics like oxygen is. And the minister was here, if you recall, last week, saying that there was no rationalization for the costs that were being charged, given the fact that they get it for quite cheap. And then, of course, just the general cost of care. Last night, I was up late just wondering if I got sick and needed to be in intensive care, if I had enough savings. And I came to the conclusion that I do not, that I'll probably last like 2 days or 3. And I am a salaried monthly employee with quite a bit of privilege. So how is the ordinary Ugandan faring in this? And it's at the fear is at the top of everyone's mind. Today I was at a fisherman market, and they were all wearing masks. They were very strict about letting us in. They had ropes. No one is bringing us corona. And a lot of them were actually asking, like, how are we going to do this if we got sick? A number of them said, how are we going to get vaccines? We had the vaccines run out. They're not even near us. Even if now they've even locked us down, how do we get them? Because we want to make sure we can protect ourselves. But a major, major concern for everyone right now was the cost of healthcare. And I think that the government is saying, they're profiteering of a pandemic. But the government led to this situation. We liberalized, commercialized, and privatized our health system. We said hands off, let other actors come in and take the burden, right? So we declined financing for healthcare over the years. Even in the middle of a pandemic, they were trying to cut the health budget. In this same budget here that they had passed, there was no money for maintenance of oxygen plants. Are we being serious? And then at the same time, they have said other actors can come in and did not pass any real attempt to regulate actors. And ISA has been calling them for a while and said, you people, healthcare is not a good you trade in a marketplace. It's a right. Any actor in this space must be regulated. But they have not done that. They have pushed for public-private partnerships. They've even sometimes invested money. If you're thinking about Lubowa or the new medical credit fund, which will give billions to private for profit in health with very little conditions. But look at the state of our health systems. In Namayingo, a health worker was telling me that they cannot even test, that they have no test, they had no testing kits at Buyinja, and for her, she's even based on one of the islands. So people come before her, she guesses off the symptoms, tells them to go home and stay there. She is scared, like terrified. So we have to really think, like, yes, we are blaming Ugandans for not adhering to the lockdown, but we had a year. We had a year. God gave, and I said this before, God gave us a year because we are a small country to get it together, to build a strong public health system, because every country that has fought this successfully has had to have a strong public health system. If you recall in the beginning, when government was centralizing and sort of running things inefficiently, everyone who got COVID got out. So we were not in this situation, because why? With the cases we have, do we have to be locked down? We have to be locked down because we did not do what we were supposed to have done in this year. The minister came last year and said, we are going to set out these things to a public health system. Some of them were not done. But when we asked them to say among the things you should do is prioritize also making sure that you are regulating the private sector, you have data on their numbers, you're not doing so. So the reality right now is, to get a test is very expensive. If you can't get it in government, to get it in private is very expensive. To get an ICU bed is very expensive if you can't get it in public. And people are saying 78 million. Even after we launched our publication yesterday on profiteering of a pandemic, messages kept coming in this morning now with people's bills. And it's going to a point where people will say, okay, as an ordinary Ugandan, who looks out for me? Who does this country serve? And now we're in a lockdown. People are worried about their incomes. They do not know how they will just have food or you know, and they have to go out. They know they should stay, but they have to go out. At minimum,
Babazi, with
focus on health center.
ALLANA KEMBABAZI, just to cut you short on that, with the lockdown in place, what would you say should be on top of the agenda for the government?
Main top of the agenda right now is making sure people can get health care. That is the thing, because there is no family in Uganda right now.
The government to actually work towards that.
It must put the money and in public health facilities, because we have all realized, even those people who thought they were okay, they were well off, upper middle class, you cannot afford these bills. Put the money in public health facilities and actually make sure those things are working. There should be stewardship. You don't just throw money. You go there and make sure there is no business of running around. So, you know, put it there, make sure it's working. Think about things like widespread testing. Why, for example, do tests have to be expensive? They should be free testing. Free testing, and it should be out there, like sort of easily accessible. The same thing with making sure that we're able to have oxygen. Oxygen is the single most important thing for people who are who have any sort of severe symptoms from COVID-19. And the fact that right now we've basically left it to the market is a very worrying phenomenon. A lot of Ugandans are very stressed about this. My own father the other time was saying, we have to stay in because there's no oxygen, I can't afford the prices. So we definitely have to focus on getting the basics in the public health system. Now, when it comes to the private, we must regulate the private. We are in the middle of a pandemic. No one wins if we think that the market forces of supply and demand are going to operate. And in fact, the market forces of supply and demand are not operating right now. There is price gouging. So we want to make sure the government has said they sent Kanona Kalema to check on those who are doing, who are price gouging. But we need more. We need real legislative framework. We need penalties for non-compliance. We need to also think about whether, if things continue to worsen, whether you may not need to temporarily even nationalize sort of how you're treating people. Because if you need beds and they're there and people can't access them because of cost, and let's just hope we never get to that point where the case is sad. But if they continue to do so, I've seen countries that have had to reach this level, like certain states in India and other areas, where when things got crazy, they had to. So those are the key things that I would say. Financing the public health system, regulating the private health system. And also, now that we're in a lockdown, the president talks about social protection measures. And Ugandans are wondering, what are those going to be like? I hope you're not bringing for us food again. I think they should be thinking about cash transfers. Other countries have also experimented with this. It is a more efficient way to do this than the soldiers going back and forth. But to the biggest question also in Ugandan's mind right now, besides will I get health care if I get sick? The other big question is, where is the COVID-19 money? And we need to see that accountability. We need the government to come out and say this is what has been done. And we know that the Office of the Auditor General found issues with some of the money, but we have not seen penalties for that. So Ugandans are saying, money was given, and now here I am. I cannot get oxygen. I cannot get to know that a health worker will treat me in a public facility. And you've just left me to go and deal with whoever is on the market that is there. So I think being very serious about accountability and making sure that money actually went the public health sector and regulating, because in private, there are all kinds of quacks. There are some, for example, who have decided they're not accredited, they don't know what they're doing. Someone was recently telling me they had mild symptoms, they had to be put on a drip, I asked what exactly, was the person having trouble breathing, what exactly? And this person said, I don't know any of those things. Me, they told me you've tested positive, we must do all these things. And the person was not in a serious condition. So we have to really think through, who else besides government are we letting operate in this healthcare space? Are they exploiting our population? But above all, for me, I hope this is a wake-up call for all Ugandans.
All right,
We have sat here, ignored our health systems, and then we think we are privileged. Now you've realized, whether you're rich or poor, when you privatize and commercialize healthcare, there will definitely be price gouging. And in a pandemic, we will die.
All right, thank you so much, ALLANA KEMBABAZI. You do really point it out clear that it is a wake-up call for every single stakeholder, the citizen, the government, the private sector. But I also know that it is a time to work together and find a common ground on how to address the pandemic. We need to come together and, of course, ensure that every single person can at least access medical care. The rich, the poor. Right now, COVID-19 has showed that we are all can actually get affected by the COVID-19 pandemic in different ways. Thank you so much, ALLANA KEMBABAZI, who's the programs manager at the Right to Health of the Initiative for Social and Economic Rights, joining us tonight to basically answer some of the questions. There are quite a number of questions when it gets to COVID-19, the lockdown, access to medical care, and the like, and we'll keep on searching for answers to these questions. You're still watching NTV Weekend Edition.